Hello everyone. So today we are going to talk about otosclerosis. So starting with the basics. So consider this as the part of a membranous labyrinth, that is our inner ear. So this membranous labyrinth will be surrounded by the bony labyrinth that is formed by inchondral ossification. Now in this bony labyrinth, there are some areas which do not ossify throughout life, means they remain cartilaginous as such. So they have the cartilaginous rest cells and they have the capacity to divide when triggered. And trigger for this division of these cartilaginous rest that are present in the bone is a viral infection, that is post measles, or an autoimmune cause, or the mutation. So these triggers cause the cartilaginous rest within the bony labyrinth to divide. One of such area is located just so this is for semantic purpose. This is also the medial wall of middle ear, and this also being the same, so showing it twice. So this is the area that is oval window with the stapes suprastructure. So one such area is located anterior inferior to it, that is known as fistula antifenestrum. So after there is a trigger, means due to a viral infection, post measles, or autoimmune cause, or a mutation, this area of cartilaginous rest is activated, and here the cartilage, here it starts proliferating. Okay, so it starts proliferating and it's cover oval window as shown in this diagram. As we know that now the oval window has the footplate of stapes and it gets fixed due to this growth, and there is fixation of footplate of stapes, that is known as otosclerosis. Now when we see the histopathology of this area, we see that there are a lot of osteoclasts, that is multinucleated giant cells. There are osteoblasts, okay, and there are blood vessels which are surrounded by an envelope of bone, and this envelope of bone is what is known as blue mantle of Menasce. Now this is known as blue mantle, means blue envelope, because it on histopathology the bone appears blue. This bone appears blue, and Menasce is the person who discovered it. Now what is osteospongiosis? This is the phenomena that due to repeated modeling and remodeling, this bone becomes the bone in this area becomes spongy and immature, and this is what is known as osteospongiosis. So these three phenomena are seen in the case of otosclerosis. Now moving on with the clinical features of otosclerosis. So patient of otosclerosis is generally a female because they are twice more prone to otosclerosis, and this is during the third decade. So there will be a woman in her third decade, okay, who is having otosclerosis. Now this condition is stimulated by hormonal changes, mean menopause or some other hormonal changes. If inherited, it is autosomal dominant, and 70 to 85% there is bilateral otosclerosis. Now we need to remember that this condition is the most common cause of bilateral progressive conductive hearing loss in adults, okay, whereas the most common cause for bilateral fluctuating conductive hearing loss was ASOM. Now other phenomena we need to remember about this condition is the first, paraacusis willis. Now this is a condition where patient hears better in noisy surrounding. We will consider a situation that a woman who is in her third decade, a white woman, because this is more common in white peoples, and around her third decade is traveling through a street which is really very crowded. Now vendors there are shouting, and the when the female presents in the hospital, she tells that she hears well in the crowded surrounding. She can hear the vendors clearly saying aloo le lo, pyaj le lo. She hears it very very clearly. Now this is the phenomena that is known as paraacusis willis. This is because in the crowded surrounding, the people who are shouting, this noise that they are making crosses the threshold of this person, that is the woman with otosclerosis, and hence she is able to hear clearly what in the loud surrounding due to the louder voice of the people. Another phenomena is low voice or low tone of the woman or the patient. This is because of conductive hearing loss. There is masking of the sound that is coming from outside. This is responsible for the woman speaking in a low voice. And one more and the final thing we need to remember is that these otosclerosis that occurs due to infection can release toxin in the inner air, or itself it can invade the inner air fluid. Now this causes the otosclerosis of our spiral ligament of inner air, that is along the along our organ of corti. So this otosclerosis hyalinization of our spiral ligament leads to a cochlear otosclerosis, and this condition will lead to a sensory neural hearing loss, and this can lead to finally a mixed hearing loss. So otosclerosis can also lead to mixed hearing loss. Another thing we need to remember is a triad or the syndrome, that is the Van-der-Rohe syndrome. In this condition, the child will have osteogenesis imperfecta, he will have blue sclera, plus he will have otosclerosis. So this is one syndrome we need to remember. Talking about the investigation that we do in the case of otosclerosis, while we do the audiometric test, we get to know that Raynaud's test is negative because bone conduction here will be better than air conduction because of masking. Weber's test will lateralize to the same affected air. ABC will be normal. Schaubeck will be lengthened. Okay, it will be increased because of conductive hearing loss. The patient will be hearing for longer duration than the normal person. Jelly's test here, because on pressure changes or anything, already there is a fixed stapes foot plate, so on changing pressure there will be no change in the sound that the person is hearing. So Jelly's test will be negative, contrary to the normal person where it comes out to be negative positive, sorry. Going on with pure tone audiometry, there will be a gap AB gap of more than 15 decibel, indicating a conductive hearing loss. And characteristically, there will be a dip at 2000 Hz that is known as acoustic dip. Now, this occurs because the stapes foot plate has a resonating frequency of 2000 Hz, and it transmits this sound as its resonating frequency. As this is fixed, there will be no transmission of the resonating frequency of the stapes, and there will be a dip seen at this frequency. On seeing the tympanogram of this condition, we will see a AS type of curve. Okay, so this is what we needed to know about the otosclerosis. In next video, we will talk about management of this condition. Thanks for watching.